Very warm welcome to you joining this series of conversations on the subject of clinical impasse, where my focus will be looking at the racial or ethnic dimension of our work and some of the struggles and difficulties we may experience from time to time in trying to make sense of this in the consulting room. I'll focus primarily on the malignant use of these differences and where at certain moments they can be seized upon by the patient in a rather opportunistic way for defensive purposes that involve weaponizing them to attack any thinking or curiosity that might otherwise develop. Now, I'll try to illustrate this by describing to you an experience of working with a patient whose only means, at least at the beginning of our meeting, was to communicate his pain by trying to provoke and inflict it on me, primarily through his comments about my skin color and identity. There was a kind of relentless quality to this. Now, I think these situations can often create an atmosphere that may make it very difficult to remain receptive enough to be emotionally affected, but not so infected to paralyze our capacity to be both curious and concerned for our patients. However, where possible, if we are able to survive these moments in small incremental ways and allow ourselves to interrogate the full range of thoughts and feelings that become stirred up in us, either in the moment or on later reflection, then I think it can give us vital clues into what is encrypted and therefore hidden beneath this type of volatility in the patient, and provide some understanding of our patient's pain and suffering. I think being able to survive in trying to remain thoughtful under their watchful eyes can help them to become stronger in resisting the urge to become destructive to themselves and others. And herein, I think, lies the hope of shaping the destiny of these racial moments.